On this edition of Veterans Health Watch, we'll learn about the broad range of services available to veterans throughout the VA Maryland healthcare system. We'll also learn about the Veterans Access, Choice, and Accountability Act and how that impacts veterans. So please join us. Welcome to Veterans Health Watch, a program sponsored by the VA Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin. The VA Maryland Healthcare System strives to provide quality, safe, and compassionate health care to Maryland's veterans. And as part of that effort, we like to educate veterans on the services and programs available to them. Joining us to start that discussion is Dr. Sandra Marshall. She's the Deputy Chief of Staff for the VA Maryland Healthcare System, and Stacy Bullock, the Assistant Chief of Medical Administration Services for the VA Maryland Healthcare System. Thank you both for joining us.
It's my pleasure.
Dr. Marshall, let's start with a discussion on the services, the healthcare services available to veterans enrolled in the VA Maryland Healthcare System.
Okay, well, the VA Maryland Healthcare System is here to provide the continuum of care to eligible veterans in Maryland. Today I'd like to highlight the Managed Care Clinical Center. It's one of our largest clinical centers, and in that program we have primary care, we have women's comprehensive care, which is care that provides both gender-specific and primary care to our women veterans. We also have dermatology, audiology and speech therapy, and we also have a program of environmental medicine where we do registry exams for veterans who've been exposed to different agents such as Agent Orange or depleted uranium. For those veterans that are enrolled in our primary care program, we have them assigned to the patient-aligned care teams, or what we call PAC teams.
Oh, I'm sorry.
That's okay. I was just going to say that. And then the PAC teams are composed of a provider who's assigned to the patient. Could be a PA, a nurse practitioner, or a physician, and also a nurse case manager, a health tech, and then a clerical assistant.
And what is the function of that PAC team? And
Right.
how can veterans access their team?
Well, the PAC team is responsible for the veterans' care. So it's a patient-driven team approach to providing effective, comprehensive, and continuous care to our veterans. We really emphasize active communication and really coordination of health care for veterans that are enrolled in primary care. So the healthcare providers can work with different services such as social work, or our clinical pharmacist, or particularly our mental health providers, to help patients and our veterans receive the kind of comprehensive care that they need. There are a number of ways that they can contact their health care team. They will certainly see their PAC team when they come in for their visits. They can also contact them through the telephone. We have numbers assigned to the different PAC teams at our various locations. And we also have a wonderful program through My Healthy Vet. We have a secure messaging system that allows veterans to send secure emails to their PAC team members.
So it sounds like a real team effort.
Absolutely.
For the veteran. And what about other services? You mentioned several services under managed care. Are there more services that veterans are eligible to receive through the VA Maryland Healthcare System?
Yeah, there sure are. So within primary care, we really look to use all of the continuum of care that we have within the services available through the VA Maryland Healthcare System. So within that program, we have integrated mental health services within primary care. We have MOVE program, which is our exercise and weight management program for veterans. We have social work benefits that veterans can receive care for. We have nutritionists that work with us. We really have an emphasis on taking care of some of the common chronic medical conditions that veterans have. So we have programs for diabetes and hypertension, for depression, for PTSD. We also focus on preventive measures as well.
And many veterans, I know, when they hear VA, the VA
Mm-hmm.
healthcare, they think of downtown Baltimore or Cecil County, Perry Point. Tell us about the other locations where veterans can receive their health care services.
Okay, so besides Baltimore and Perry Point, we also have 6 community-based clinics. So we have 2 clinics on the Eastern Shore. We have those in Pocomoke City and Cambridge. We have another site in Baltimore City at Loch Raven and the Alameda. We have a site in Glen Burnie in Anne Arundel County. We have Fort Howard. And then we have a newest CBOC, which is at Fort Meade Army Installation. So that is our newest location for veterans who are interested. And for those veterans who don't come to the main medical centers at Baltimore or Perry Point, we have the ability to do a lot of telehealth programs at our community-based clinics. So we have telemental health, we have our telemove program with exercise, we have some specialty services, we do imaging of the retina for patients with diabetic eye disease at all of our community-based clinics. We have teledermatology, and we're just adding more and more programs over time to assist veterans to receive care in their local community.
It's wonderful. It's always
Yes.
always good to hear that we're opening access to care for veterans. Now, Stacy, can you tell us a little bit about the eligibility criteria for a veteran to receive health care services through the VA Maryland healthcare system?
Certainly. The eligibility criteria is factored by 3 different areas. The first area is the discharge that the veteran received when they got out. They had to have an honorable discharge or general under honorable conditions. Also, it is predicated upon the length of service, the length of time in service that the veteran served. They have to serve a continuous 24 months to be eligible. They also can be eligible through their service-connected disability, and we also look at eligibility through the income level.
I know many veterans are surprised to hear that they actually have to apply for VA healthcare services. Some of them think it's automatic when they get out of the service or if they have a disability. So what should a veteran expect to receive or hear when they are determined to be eligible for services?
When they're determined to be eligible for service, they'll receive a written notification from our Health Eligibility Center, and that should it could take a little time, but they'll receive their letter in the mail and let them know that they're eligible for care at that time.
And it's best they can apply, they can call?
They can apply online, they can call, they can write, they can visit they can visit the nearest VA medical facility to their home. And at that time, they'll be taken through the step-by-step process to get eligibility for enrollment.
Awesome. And once that person is found eligible for VA healthcare services, how does he or she make the first appointment?
The first appointment can be made for primary care by calling our appointment line, and the clerk on the other end will help them with the process of scheduling their first appointment to their nearest VA facility. However, if when they are scheduling their appointment, they notice that they can't get them in within 30 days, we've initiated a process that they can get in faster by being seen through Evergreen Healthcare System. And Evergreen Healthcare System, they have 4 different facilities throughout the state of Maryland so that a veteran can be seen nearest their home.
And you mentioned the appointment call center where veterans can schedule an appointment. I know that center can also be used to cancel an appointment. It's very important that veterans cancel their appointments if they can't make it. Could you tell us why that's so important?
Yes, that is absolutely true. They can call in to confirm or cancel the appointment. Canceling the appointment prior to the scheduled time is extremely important because what happens is the veteran will be counted as a no-show if they do not call to cancel. And it's also a missed opportunity for their fellow veterans. Someone can get in to be seen if there's this opening, and it just makes it easier for our reducing our wait times as well. And all veterans can be effectively seen in the clinics.
Well, thank you two so much for the information you provided. We're going to continue our discussion about the healthcare services available for veterans, but we're going to take a short break, so please stay tuned.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and and share common experiences with.
The amount of medical attention that I received has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.
The Appointment Call Center is a fast, easy, convenient way for a veteran to call in to schedule, change, or cancel an appointment.
You can reach any of us by calling 1-800-463-6295, extension 7333.
The call center is open Monday through Friday from 7:30 a.m. till 5 p.m. If you need help scheduling an appointment, call the call center because we're here to help.
Welcome back to Veterans Health Watch. The Veterans Access, Choice, and Accountability Act, recently enacted by President Obama and Congress, was designed to help give some veterans opportunities for more healthcare services in their local community. And joining us to discuss the new Choice program is Sherry Early, the Chief of Medical Administration Services for the VA Maryland Healthcare System. Sherry, thank you so much for joining us.
Thank you for having me here.
Sherry, could you start us with a discussion about the intent of the new Choice program for veterans?
Sure. The Veterans Choice Act was passed into law to assist all those veterans who may have to wait longer for appointments. It's to improve access to care. Any veteran who was enrolled prior to August the 1st, 2014 is eligible, or any combat veteran who was discharged and receives care within 5 years of discharge.
And Sherry, what is the eligibility criteria for veterans to participate in the new Choice program?
Okay, like I said, they have to be enrolled before the August 1st, 2014. The second criteria would be that they live within 40 miles of any VA healthcare facility, or they're waiting more than 30 days for an appointment.
And what about those veterans who, you mentioned an appointment, is that mainly primary care appointment, or does it include other specialty care appointments?
It includes any appointment. It can be primary care or any of the specialty services. If they can't be seen within the VA within 30 days, they're eligible to be seen out in the community.
And what about those veterans who may not fall within that 40-mile radius?
Those who don't fall within the 40-mile radius, they still would be eligible if they cannot be seen within 30 days.
And what criteria do you use to determine the 40 miles?
The way the VA measures it is a straight line distance to any VA facility, so it's not including driving distance. So if a veteran has to drive around water, they don't include that. It's just a straight line distance from their home to any healthcare, any VA facility.
And we mentioned that the VA Maryland Healthcare System has inpatient facilities as well as the community-based outpatient clinics.
Yes, and they also include those community outpatient clinics. So if a patient needs some type of specialty care, like an ortho appointment or something, and that community outpatient clinic does not provide that care, that's still included. So they still would not be eligible for the 40-mile radius.
And will the veterans who are found eligible for this program receive a card, Choice card?
Yes, the cards are actually being sent out in 3 different phases. The first phase was all the veterans who lived more than 40 miles from any VA facility. Those cards were mailed out first. The second phase is any veteran who is actually scheduled for an appointment that is more than 30 days out. What happens, we send a list out to our vendor, and they actually are sending them the card saying your appointment is more than 30 days out, so now you're eligible for the Veterans Choice Act. And the third phase is every veteran who is currently enrolled in the system is going to receive a card. And they're mailing those out in November, December, and January of 2015.
And so for veterans, maybe they want to look for themselves to see if they're eligible. How do they go about doing that?
Well, there's actually a toll-free number that they can call to see if they're eligible. Another way that they know if they're eligible is when they make the appointment at any of the VA facilities. If it's more than 30 days out, the clerk who's making the appointment will give them a phone number to call to let them know that your appointment is scheduled out more than 30 days, so you can call this number and you can be seen on the outside.
And of course, we just gave a brief introduction to the Choice program. How can a veteran learn more about this program?
Well, we actually have a toll-free number that the veteran can call, or they can visit the VA website, or they can actually call one of our VA facilities and we can have somebody talk to them about it.
Great. Well, Sherry, this was, again, like I said, it was just an introduction to the Veterans Access, Choice, and Accountability Act. But was there any more information you'd like to share?
Yes, one thing that I just wanted to clarify, we just need to make sure that all the veterans understand the care must be pre-authorized before a veteran goes for an appointment. So if a veteran goes out into the community for an appointment without that pre-authorization, they do stand a chance of being billed a charge or a copay for that visit. So we're just asking every veteran to make sure that they are authorized for that care. And the Veterans Choice Card that is sent out tells them exactly what they need to do and the number that they need to call in order to get that authorization.
Okay, so please get your authorization to avoid any issues.
Yes.
Great. Thank you so much for being with us, Sherry.
Oh, you're welcome.
We're going to take a short break, but when we return, we'll learn more about the services available to veterans throughout the VA Maryland healthcare system. So please stay tuned.
We are committed to quality, safe, and compassionate healthcare to the veterans we serve here in the VA Maryland healthcare system.
They do all that they can possible to make sure that the veteran is comfortable and have all their answers addressed, their needs met. I wouldn't choose to go anywhere else.
We're always trying to get better
by improving customer service, wait times, and quality. This is a duty we take seriously.
As a nurse, it's very important for me to see a friendly face when I come into the hospital.
On my last tour, I was a drill sergeant, training some soldiers, and had an unfortunate accident.
I really didn't think I was qualified because I didn't have a service-connected disability.
I researched because there had to be some answer somewhere. There had to be some place for combat veterans to go.
Did you know that the Department of Veterans Affairs has been recognized for offering the best medical care in the U.S.? Locally, the VA Maryland healthcare system provides a full continuum of quality care to our nation's veterans, including medical, surgical, rehabilitative, neurological, primary, mental health, and long-term care. With a dedicated, highly trained staff, the VA Maryland healthcare system is committed to serving the needs of our nation's veterans at 8 locations throughout the state. The VA Maryland healthcare system is always there to serve and honor America's veterans.
I would highly recommend all veterans to at least come down here and talk with the patient representatives and see what they are entitled to.
If you or someone you know served in the armed forces, tell a vet to call 1-800-463-6295, extension 7324, to inquire about enrolling in the VA Maryland healthcare system. It's free to inquire and easy to enroll, so call now.
When I came home from my military service, I knew that I needed help, and I went to the VA and they were there for me.
Volunteering is an opportunity to show your patriotism.
Most importantly, it's a good feeling knowing that you're helping those who have already served.
And it's always an honor and a privilege to me to be there because I know that I get to help the men and the women who have served us.
So if you're interested in volunteering with us, best thing is to get in contact with us through our webpage, or you can also call us.
It really gives me an opportunity to give back, make a difference.
Welcome back to Veterans Health Watch. Joining us to continue our discussion about the healthcare services available to Maryland's veterans is Dr. Eugene Delera, the Chief of Pharmacy Service for the VA Maryland Healthcare System, and Valerie Coleman, the Assistant Chief of Consumer Relations for the VA Maryland Healthcare System. Thank you both for joining us.
Thank you.
Dr. Delera, we'll start with you. Could you give us a brief overview of the pharmacy services?
Well, thank you, Ken, for having me. The pharmacy, we're really excited about our ability to take care of our veterans. I think most veterans would be surprised the sheer volume of prescriptions that they receive. Every year we process over 2 million prescriptions, and that's really remarkable. We have a tremendous team when you think about our wait times. And if a veteran is admitted to the hospital, we have inpatient pharmacists and technicians. They're doing a tremendous job as well, making sure that the right drug goes to the right patient at the right time and for the appropriate indication. Also, more specifically to your question, we have advanced practice pharmacists, clinical pharmacy specialists, and they're involved in behavioral health pharmacy, ambulatory care, and ambulatory care pharmacists particularly are the ones that work for the PAC teams, and they work with disease state management, any kind of issues that are problematic, and help to resolve that. we often say in pharmacy, the best medicine is one that the veteran actually takes. So they're involved in ensuring that.
And you mentioned the PAC team earlier. Dr. Marshall, the Deputy Chief of Staff for the VA
Yes.
Maryland Healthcare System, told us about how this team works together with other services to treat the veterans.
Yes, we're very supportive of that.
And then we also learned about the Veterans Choice Act, the new Veterans Choice Program. How does the pharmacy service interact or engage with that program?
Thank you. Well, we already have the tools and the resources to be prepared for that. One of the things that we have to make sure that the patient has the prescription, obviously, and it's on the formulary. So the same rules apply to non-VA physicians, to VA physicians. Also, importantly, is the authorization, and then again, the VA choice card. So those key pieces have been, a lot of questions have been received about that. But if all those pieces are in place, we're able to handle those prescriptions.
Ms. Sherry Early mentioned authorization, making sure you get the appropriate authorization
Yes.
before you move forward.
Yes.
And what about any other new programs on the pharmacy side of the house to advance the care for our veterans?
Yes, Kenya, we're very excited. Just in April, we have a new program started with Heritage. So prior to July, if a veteran was seen out at one of our community-based outpatient clinics, and let's say the provider needed to start an urgently needed medicine, for example, an antibiotic. Well, really the only choice was the patient had to come to the Baltimore or Perry Point pharmacy for that prescription to be filled. Or we could overnight express it. So obviously there's some disadvantages to those programs. Now the provider can give the patient a prescription or the veteran a prescription and a voucher, and they can take it to a local retail pharmacy. So this has been a tremendous change, and I think a really veteran-focused program for our veterans.
Right. Another way that we're looking out for the veterans. When you say they're given a list of providers, are they, or actually I should say, are they given a list of providers in the community where they can take that prescription?
Yes, so when the veteran leaves that appointment with that provider, the nurse or the provider will give a list with that voucher and prescription of the participating pharmacies that will already be signed up in that Heritage program.
Great.
And I may add, and there's no cost to the veteran for this program, regardless of their, as long as the provider says it's an urgently needed medication and it's on that formulary, it's no cost to the veteran.
We like that. And what about those veterans who need to request a refill? What are some of the various ways that veterans can request a refill for a prescription?
Well, we understand that our veterans have different levels of comfort with technology. My personal preference is My Healthy Vet. It's the most robust feature. You know, you can request your refill, you can ask a question of your provider or nurse. Now you can check the status of that refill. So it's really a good means of requesting your refill.
And that's the online
The online
service.
version, yes. And then also you can request your refill via the telephone through the 1-800 number, which probably most of, or at least half of our veterans are using the call-in refill service. And then lastly, through mail. So just on each prescription has the request slip and a mailing address, and you just add a stamp to it and send it right in. And that's probably the easiest way.
And most of our veterans are pretty prompt people, but for those people who procrastinate a little bit, what advice would you give them when it comes to those medication
Thank you,
refills?
Kenya. Yes, I would say at least give yourself 2 weeks, and some really savvy veterans, they'll send in that refill request just as soon as they receive their medication. We always say request your refill before you run out.
And okay, so for the times when you do run out, if a veteran runs out of a prescription, what should he or she do?
Well, obviously you'll need a new prescription, but that doesn't necessarily mean the veteran has to come in for an appointment. So they can use the nurse telephone care line, or they can just contact their provider. And, but also you could do that through My Healthy Vet. So there's different options, and then the provider will make that determination on what's the best way.
Great. Thank you so much, Gene. And Valerie, over to you for consumer relations. I understand consumer relations supports lots of several services, or many of the services throughout the VA Maryland healthcare system. But how does consumer relations support the veterans?
Consumer Relations Service actually supports the veteran by being that person that will help them navigate different systems. What we try real hard to do is let them know that we encourage them to do various surveys that we have so we can get the voice of the veteran. One of our surveys is the Survey of Healthcare Experience for our veterans. We call it the SHEP, and most of our patients know it by that name. And we also, that is a national survey. We do an on-site survey called the Truth Point. It's done by the veteran actually going into a small device, it looks like a tablet. They're answered the questions anonymously, and all this information is fed back to us in our office. In our office, we have patient advocates. Those patient advocates also help the patient understand the importance of providing that type of information. We also encourage our veterans, if they have any concerns, complaints, or if they just have an issue or suggestion, to come to us. But the very first point of contact when they have a problem is their care team. We want them to have that relationship. So we do encourage them to do that first. If they cannot get results by doing that, then they come to see us. And the patient advocate helps them.
I was going to ask more about that. You mentioned the patient advocate. Could you explain the patient advocate role and when a veteran should contact the patient advocate for assistance?
They can call or contact us at any time. We have walk-in hours as well as we have a voicemail system where if it's after hours or holidays, they can leave a message and we will get back with them. Our goal is to help them navigate through the various services if they're having some roadblocks or maybe some challenges. And we do that at almost every one of our sites because we have patient advocates throughout the Maryland system.
Great, good to know. Valerie, if a veteran is in the medical center or one of the facilities at a time when they run into a roadblock, they've talked to their team and they still can't get any assistance, when or how should they contact the patient advocate then?
That's a very good question because oftentimes we have our consumer reps who are on the floor with our Truth Point device, and they do take the concerns of the veteran as well. There's also an application on that device that says I need an intervention. I'm having an issue with whatever it is. It could be a social work issue, it could be a doctor issue, a nurse issue. It doesn't matter because that intervention piece on that device allows them to state what the concern is, and it goes directly to that provider. If they do not get results from that, then they just call us, call our number wherever they are. If they're at Perry Point, they call 5097. That's the extension for the patient advocate there. If they're at Loch Raven campus, where we also have long-term care as well as CBOC, which is our community-based outpatient clinic, we have a number there at 7542. And then if it's at the Baltimore site and it encompasses either Fort Meade or Glen Burnie, they would also call the Baltimore number at 7099. And we would go to them if they were calling us from any one of those sites.
And we also want veterans to know that we love to hear their compliments.
Yes.
So the patient advocates can also take those compliments for their care teams or anyone who helped them or was particularly good at their job at the VA Maryland Healthcare System.
Correctly.
Good.
It's called Job Well Done.
That's right. Well, thank you both so much for joining us, for giving us great information about the pharmacy services, about our consumer relations service. We really appreciate it.
Thank you. Thanks, Kenny.
Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or you'd like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or you can visit us on our website at maryland.va.gov. You can also join us on Facebook and Twitter. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland Healthcare System, please tell them to give us a call, stop by one of our facilities, visit us on our website. We look forward to hearing from you and we'd love to serve you.
Applying for the VA healthcare system is one of the best things you can do for your health and well-being.
A lot of veterans, for some reason, don't realize that they are eligible for VA healthcare benefits.
So we always encourage the veteran to call because each veteran is enrolled on a case-by-case basis.
Once I obtained the knowledge that I could enroll, I enrolled, and it's been a great decision ever since.
A veteran can learn more about eligibility for VA and health care at 1-800-463-6295, extension 7324.